Fibroids, or uterine fibroids, are non-cancerous tumors that develop in the uterus. They are also known as leiomyomas or myomas. Fibroids are quite common, particularly in women of reproductive age. They can vary in size from very small to larger than a grapefruit and can be single or multiple. Types of fibroids: intramural fibroids. Location: embedded in the muscular wall of the uterus. Impact: may cause the uterus to expand and can affect menstrual flow and fertility. Submucosal fibroids. Location: just beneath the lining of the uterine cavity. Impact: can cause heavy menstrual bleeding and may affect fertility by distorting the uterine cavity. Subserosal fibroids. Location: on the outer wall of the uterus. Impact: may cause the uterus to bulge and can potentially press on other organs, leading to discomfort. Pedunculated fibroids. Location: attached to the uterus by a stalk. Impact: can cause pain if the stalk becomes twisted or if the fibroid is large. Symptoms: many women with fibroids experience no symptoms and may only discover them during a routine pelvic exam. When symptoms do occur, they may include heavy or prolonged menstrual bleeding, excessive bleeding or bleeding between periods, pelvic pain or pressure, discomfort or pain in the lower abdomen or pelvis, frequent urination, due to pressure on the bladder, difficulty emptying the bladder, caused by pressure on the bladder, constipation, pressure on the rectum can affect bowel movements, back pain, lower back pain can occur if fibroids are large, pain during intercourse, discomfort during sex can occur with certain fibroids. Causes and risk factors: the exact cause of fibroids is not known, but several factors may contribute to their development. Hormones, estrogen and progesterone, are believed to stimulate fibroid growth. Genetics: the family history of fibroids may increase the risk. Age: fibroids are more common in women in their 30s and 40s. Race: African American women are more likely to develop fibroids and may experience more severe symptoms. Obesity: higher body weight may be associated with a higher risk of fibroids. Reproductive history: early onset of menstruation and history of not having children may be risk factors. Diagnosis: fibroids are often diagnosed through pelvic exam. Healthcare provider may feel abnormalities during a physical exam. Ultrasound: transabdominal or transvaginal ultrasound is commonly used to visualize fibroids and assess their size and location. MRI magnetic resonance imaging provides detailed images and can help in planning treatment. Hysteroscopy: a procedure where a thin, lighted tube is inserted through the vagina and cervix to view the inside of the uterus. Sonohysterography: an ultrasound procedure with saline injected into the uterus to get a clearer view of fibroids. Treatment options for fibroids depend on the severity of symptoms, size and location of the fibroids, and whether the woman wants to preserve her fertility. Medications: hormonal therapy, birth control pills, progestin-releasing intrauterine devices IUDs or GnRH agonists can help manage symptoms. Non-hormonal medications, pain relievers and anti-inflammatory drugs can help with pain and heavy bleeding. Non-surgical procedures: uterine artery embolization (UA), a procedure that blocks the blood supply to the fibroids, causing them to shrink. MRI-guided focused ultrasound uses high-intensity ultrasound waves to destroy fibroid tissue. Surgical options: myomectomy, surgical removal of fibroids while preserving the uterus. It can be done through hysteroscopy, laparoscopy, or abdominal surgery. Hysterectomy, complete removal of the uterus. This is considered if fibroids are severe, and fertility is not a concern. Lifestyle and home remedies: diet and exercise. Maintaining a healthy weight and eating a balanced diet may help manage symptoms. When to seek medical attention: consult healthcare provider if you experience heavy or painful menstrual bleeding that interferes with daily activities, pelvic pain that is persistent or severe, frequent urination, or difficulty with bowel movements. Symptoms impacting fertility. If you have difficulty conceiving or experiencing recurrent miscarriages. Conclusion: fibroids are common and often benign, but they can cause significant discomfort and symptoms in some women. Management and treatment depend on individual circumstances, including the severity of symptoms and reproductive goals. Regular monitoring and working with a healthcare provider can help manage symptoms and choose the appropriate treatment options.